Now, I haven't read these stories. I am just going off the headline. Okay, so cut me a little slack here. I'm trying something new. The first story here is Kaiser Permanente posts 4.5 billion in Q2 net income. A couple things jump out at me with this. One of the things we did when I was a CIO is we created a thing called IT University, and part of the IT University was we had people from my team, and my direct reports and myself, each had to lead a class. So we had to teach a class, had to be at least 4 hours in duration. And the CFO for my group decided to teach a class on understanding healthcare finance and understanding how to create a budget for within health IT. And it was interesting when he created the class. It was a really well attended and received class, as you can imagine. A lot of people don't understand healthcare finance and how healthcare organizations make money, and all the money they give to public good and how they all those things. So that was an interesting conversation in and of itself. But he covered a lot of things like operating income and what that means and how we look at those things. And we looked at, I don't think the word is endowments, but the investments that healthcare organizations have. And when I'm reading this headline, the first thing that pops out at me is Kaiser posted a $4.5 billion net income in Q2. Okay. So the first thing you have to ask is how much of that is operating income? And I don't know, I haven't read the story, but I would imagine a fair amount of that's operating income. They probably used the crisis as an opportunity to reduce costs. So they probably had a percentage or two drop in costs. They had an increase in revenue because Kaiser is a payer and a provider. So anytime somebody tries to compare your health system with Kaiser, you have to ask how much of the percentage of your overall business is as a payer. Right. So that's not always a good comparison. So the reason I look at this story is to say, understand what you're reading when you read these things, understand the comparisons that are being made, because you could just go down on the same page down to the bottom here. And it says Mass General Brigham reports 12% loss in margin amid patient care drought. And so you have to look at the timelines. And you have to look at what they're actually talking about. The first was talking about net income. The bottom one's talking about a margin drop. And margin drops happen when profitable business, when you're doing less profitable business and some of your profitable business has dropped out. So when we stopped doing elective procedures, that was very profitable business. And we started doing more COVID, that maybe wasn't as profitable of a type of business. So I cover that to say, as healthcare IT leaders, within the organization, part of our job is to help our organization and our people to understand the finance of healthcare, the finance of healthcare IT, where the money's coming from, and how that money should get allocated to drive what's best for the community, not only